Let's understand the bilateral advancement flaps, also known as H flap, by taking an example on the wound of the forehead. The problem with the unilateral advancement is that if the length is to breadth ratio is large, then there are chances of necrosis on the tip of the flap. Therefore, to avoid necrosis, we plan a bilateral advancement flap. First, we will convert this defect into a box shaped with length L and breadth. After that, we mark two advancement flaps on each side. This length should be approximately 2 times the breadth. This is the maximum safe limit in case of planning bilateral advancement flap on the forehead. After that, the flaps are marked. We make the burrow triangle so that the flap are raised easily, and we can avoid the dog ear. After that, we do the subgaleal dissections. While dissection, two nerves can be encountered. The first is the supratrochlear nerve and the second is the supraorbital nerve. Both of these nerves should be preserved, otherwise there will be complications such as numbness and neuroma formation, which can lead to frontal headaches. After that, this defect tissue is removed and both bilateral flaps are advanced bilaterally. Therefore, final stitch line appear as a H shape on the forehead. Thank you.